of the drug, and also a basic for what expected to know in central nervous system pharmacology. So here we will speak about the neurotransmitter and receptor of this neurotransmitter, because most of our drugs which is working in central nervous system will working through this neurotransmitter or the receptor. So we have to know the receptors and neurotransmitter. uh, Depend on the origin or structure of the neurotransmitter, we have about main four types or five types. The first one is amino acid, and here we have a glutamate or glutamic acid, GABA, aspartic acid, and glycine. Also, we have biogenic amine, which is discussed before in previous blocks and system. We have monoamine like norepinephrine, dopamine, and serotonin, acetylcholine, and histamine. Also, we have a group of peptides like enkephalin, vasopressin, somatostatin, and neurotensin. As you observe, most of them are discussed before in previous system. Here we will speak about them, the effect in central nervous system. Other neurotransmitter, we have endocannabinoids and purines, and we have gasotransmitter like nitric oxide. So here, this the classification of the drug depend on their origin and structure. We starting by the first one, which is before we starting monoamine or amino acids, we will start to discuss how this neurotransmitter will give effect like excitatory effect or inhibitory effect. طبعا النيوروترانسميتر when activating the receptors, it will give an action in the cell. This action could be excitation or inhibition of the cell, which is give effect. الeffect برضه ممكن يكون inhibitory or excitatory. طيب, how this receptor can give excitatory effect or inhibitory effect? Firstly, depend on some elements or anions like potassium, calcium, sodium, and chloride. And we have to remember that sodium is more outside. So if we increase the cell conductance and make the cell membrane permeable for sodium, the sodium will influx from outside to inside the cell. Also, the calcium has the same. It is more outside, so it will influx to inside if we increase the permeability or conductance. Also, the chloride, which has a negative charge, also more outside. So if we increase conductance, it will going to inside or influx. So if we increase the conductance of sodium, so the sodium will going from outside to inside, influx to inside, which has a positive charge. This positive charge will make the inside chargeable and excited, so it will give excitatory effect. The same the calcium. If we increase the conductance of the calcium, it will influx from outside to inside, which is make inside more positive and more excited. So it can cause excitatory effect. The chloride has a negative charge. So if we increase the conductance of chloride, it will influx from outside to inside, but because it has a negative charge, it will make the inside more negative, which is more inhibition, so it has inhibitory effect. Like for the potassium, potassium found inside more than outside. So if we increase the conductance of potassium, it will be efflux from inside to outside, and potassium has a positive charge. So the positive charge will going from inside to outside, which is make inside less positive, less excite, which is make inhibitory effect. And if we decrease the conductance of the potassium, potassium will become inside more, cannot cross to outside, and then the positive charge will be more inside, which is make or made excitatory effect. So this is about the electrolytes and effect of electrolytes. طيب, we have cyclic AMP, and cyclic AMP always when increase inside the cell can cause excitation, and if decrease inside the cell can cause inhibition. We have also installed triphosphate and DAC, also they can increase the excitation. طيب, we need to know and to understand that we have some electrolytes. If we increase their conductance, it can cause excitatory effect. And if we decrease their conductance, it will make the inhibitory effect, and vice versa. So we have to know here the excitatory way or mechanism and inhibitory mechanism, because we will discuss later some drugs, and we will say this drug will increase calcium conductance and then cause excitatory effect. We have to make a base from now to understand that the drug which is increase the calcium conductance, it will give excitatory effect. Ma'am? Fine. This is the principle of transmitter, of synaptic transmission and action potential, and it is not needed now, it is discussed before. So we're going through the types of the neurotransmitter and their receptor directly. The first one which is discussed is amino acid, and in amino acid we have 4 neurotransmitters. The first one and second one found in the ventral column, ventral of spinal cord, ventral root of spinal cord, and the third and fourth found in the brain. So the first two, glycine, and will found also aspartate. These found in spinal cord. Glycine can cause inhibitory neurotransmitter, and as we said, it is found in ventral root of spinal cord. Well, ventral root طبعا is associated with movement. So this drug can inhibit the movement and skeletal signals. So it can cause a relaxation for the muscle. If it is activated, it will cause a relaxation. So if it is blocked, it will give the reverse. It can give an excitatory effect, which is lead to contraction. And we have a drug known as strychnine, which is used as a poison. It can cause a severe contraction and looks like a tetanic convulsion. The patient curving and arched and bent his backward, head and back will bend to backward and become like a tetanic patient. So if any patient or animal taking this strychnine, it will lead to a tetanic contraction and convulsion. So the first drug is glycine, found in spinal cord, inhibitory. It is antagonist or blocker known as strychnine and has these effects زي ما قلنا like a convulsions. طيب, this is the inhibitory one. The excitatory one in spinal cord known as aspartic acid or aspartate. And as we said, just we need to know aspartate is the antagonist of glycine, and it is also found in spinal cord. Right. We have also excitatory and inhibitory from amino acid in the brain. The excitatory one known as glutamic acid or glutamate. And the inhibitory one is known as GABA. GABA is very important in drugs which is used in central nervous system, and we have many drugs working in this type of the drug or of the neurotransmitter and receptors. طيب we start by glutamate. قلنا ده found in the brain, in the central nervous system in the brain, and it has excitatory effect. And we have a NAMDA receptor. It has four receptors: NAMDA, AMBA, kinase linked, and metabotropic receptors. The most important one for us for drugs is NAMDA receptors. And NAMDA receptors is a receptors for a drug known as phencyclidine. We'll discuss with anesthetic drugs. These receptors and this neurotransmitter is associated with memory, with long-term memory and pain. That is why we use a drug which is affecting its receptors in anesthetic effect. The second in the brain is GABA. And GABA is gamma amino butyric acid, which is inhibitory. زي ما قلنا, the glutamate is excitatory. The inhibitory one in the brain is GABA. And we have two types of GABA, GABA A and GABA B. All of them are inhibitory. In GABA A, we have many drugs where target this GABA, like barbiturates and benzodiazepines, zolpidem. All of them could be used as anticonvulsant drug للتشنجات وكده, and as sedative hypnotics, منومات وكده. And some anticonvulsant like برضو عندنا anticonvulsant means anti-epilepsy, anti-seizure, مضادات للتشنج أو كده. Like gabapentin, tiagabine, and vigabatrin. And this drug is activated GABA A. وزي ما قلنا GABA A is inhibitory, so it is inhibit the excitation of the CNS, which is lead to sedation, to anticonvulsant effect وكده. طيب عندنا GABA B, and GABA B is a target for a drug which is discussed before في musculoskeletal system known as baclofen, which is centrally acting muscle relaxant, وبنشتغل به as a muscle relaxant for patient with spastic paraplegia and like that. مهم عندنا two types, GABA A و GABA B, both are inhibitory, and we have many drugs could be affecting by these drugs. Right. This is about the amino acid. The second type of the neurotransmitter is biogenic amine. And biogenic amine, we have the first type is acetylcholine, and acetylcholine is discussed before also outside the central nervous system, in peripheral nervous system, as a neurotransmitter of the parasympathetic nervous system. Also, it is a neurotransmitter of somatic nervous system or somatic nerve for musculoskeletal system. And all the receptors of the acetylcholine are excitatory except M2 اللي هي muscarinic 2, which is inhibitory. طيب. We have a drugs affecting by acetylcholine and acetylcholine receptor. The most important one in the disease affected by acetylcholine is Alzheimer's disease. And most of us know Alzheimer's disease, and is associated with memory loss and dementia. But dementia is associated with decrease of acetylcholine level. An increase of acetylcholine can increase the memory effect and decrease the memory loss. So we can treat the patient, or we can treat a symptomatic treatment for a patient with Alzheimer to retain the memory by adding acetylcholine. we give a drug which is suppress the metabolism of acetylcholine like neostigmine, phyostigmine, and pyridostigmine, and these drugs which is suppress the metabolism of acetylcholine by suppression of acetylcholinesterase enzyme. So acetylcholine level will increase, which is lead to increase the memory and decrease memory loss. So acetylcholine is associated mainly with memory loss. But also acetylcholine associated by motor coordination, which will be appear and will be clear in treatment of Parkinson's disease, and we will discuss it later in this lecture. Type. The second type, the first type, can acetylcholine in biogenic amines. The second type is monoamine. And monoamine will speak about the dopamine, norepinephrine, and serotonin. We're starting by dopamine. And dopamine is very important also, neurotransmitter. And we have two main diseases we'll discuss associated with dopamine. Also, we have other disease, like we have two major disease associated with dopamine. This disease is schizophrenia and Parkinson's disease. Also, this drug or this neurotransmitter is associated with attention deficits, with hyperactive children and who has attention deficit. The dopamine is found in nigrostriatal, mesolimbic system, and tuberohypophyseal. And it is associated with motor control, which is appear in Parkinson's clear and associated with reward and emotion. And reward is happiness or the feeling when the patient uses the drug will develop this a happiness feeling واللي هو بيؤدي إلى الإدمان يعني for addiction. So a reward effect of the drug with high dopamine, especially like optagon وكده. طيب. And it is associated also with regulation of pituitary secretion. And as we know in endocrine, if dopamine increase, it will give a negative effect in prolactin secretion, so it can decrease hyperprolactinemia. طيب. As we said, dopamine associated mainly with Parkinson's and schizophrenia, and we have to know the relation to dopamine. طيب. Dopamine in general give inhibitory action. It has two receptors, D1 and D2, and it is G-coupled receptors and give inhibitory effect. As we said, the dopamine is associated with Parkinson's and schizophrenia. It starts by Parkinson's, and we found that when the dopamine level is decreased, the patient can develop or could develop Parkinson's. And they define the Parkinson's physiology as imbalance between dopamine and acetylcholine. That means the patient who has Parkinson's, the dopamine is decreased and acetylcholine is increased. So in treatment, we have to give the patient who has a Parkinson's a dopamine or dopamine agonist. So we give a levodopa as a dopamine to increase the level of dopamine. And blocks the acetylcholine or stops the action of acetylcholine, so we can give something to block or to stop the acetylcholine like acetylcholine blocker or muscarinic blocker. In schizophrenia, the reverse or the opposite. So in Parkinson's, the dopamine is low. In schizophrenia, the dopamine is high. So we give something which is lead to blocking of the dopamine receptors. And that is why when we treat schizophrenia, we will give something which is blocks the dopamine receptors, which is make the body as if there is a loss of dopamine. So the dopamine will be non-functioning dopamine. So the patient develop a symptoms like there is a dopamine deficiency. So the patient develop a Parkinson's-like symptoms. And when we treat the Parkinson's, we give a dopamine or dopamine agonist, which is make the body like the patient with a high dopamine effect, which is give schizophrenic symptoms. So the Parkinson's treatment can lead to schizophrenic like symptoms. Dopamine associated with motor planning زي ما قلنا which is clear in Parkinson's, and dopamine associated with vomiting, and as you discuss in GI pharmacology, dopamine blocker can decrease or suppress the vomiting in patients. And also it is associated with the release of prolactin. Increase of dopamine can stop or inhibit the prolactin release. Also it is associated with emotion and rewards, as we said, which is make some times of dopamine releaser like captagon is addict drugs or abuse of drugs. Also, they found dopamine can increase the sexual behavior in male, and antagonist of dopamine can increase the sexual behavior in female. The second is norepinephrine. And norepinephrine is related also to many drugs in central nervous system. طبعا norepinephrine outside in peripheral nervous system can the main neurotransmitter of sympathetic nervous system. Here in central nervous system and in the brain, the norepinephrine is associated with pain control, learning, memory, and sleep awake cycle with stress and autonomic regulation, as we know. So the drugs which is affecting norepinephrine like which is increased يعني norepinephrine like cocaine like captagon will make the patient don't feel the pain and learning rapidly, focusing well, and the patient may don't sleep and it's affecting the sleep awake cycle and like that. The third one is serotonin in monoamine. And serotonin is known as a hormone of happiness طبعا هرمون السعادة بقول. And this hormone is or neurotransmitter is associated with emotion, pain, appetite, and give a hallucination and stereotype behavior. This drug is most likely we'll discuss the details when we discuss the drugs used in schizophrenia and also in depression. This drug, as we said, it gives some sort of happy emotion, and they found the patient with depression has a decrease in serotonin. So the drugs in treatment of depression will increase the serotonin. And also we discussed that before the appetite, the serotonin give a satiety effect. So the patient will feel he is full and will not eating more. So if we block this hormone, the patient may eating more than normal and can gain weight. So it is used in treatment of weight loss, as we use a cyproheptadine discussed in antihistamine, which is block these receptors. It has a 5 receptors. The receptors known as a 5-hydroxytryptamine, and we have a 5 receptors of 5-hydroxytryptamine. All of them are excitatory except type 1, which is inhibitor. Then we have the third types, which is peptides, and we have in peptides opioid peptides, and this is discussed in next lecture inshallah as opioid. And we have opioid طبعا most of the drug of opioid used to relieve pain and to give some sort of pleasure as addiction الناس اللي بياخدوها addiction. And we have endogenous opioid like endorphin, enkephalin, and dynorphin. We have cholecystokinin, which is discussed in GIT, and we have vasopressin or ADH, which is also discussed in endocrine. We'll not discuss in central nervous system. Other neurotransmitter, طبعا we have histamine, as we said, and histamine is a substance or a neurotransmitter of inflammation or mediator of inflammation outside the central nervous system. It has 3 types of receptors, and they said now 4 types, like in the fourth one is unwell known. So we regard as 3 types. Only type 3 is inhibitory and others is excitatory. The most common uses of antihistamine drugs used in emesis, and as you discussed in GI, H1 blocker could be used for treatment of nausea and vomiting. And also it can cause sedation because histamine can cause arousal effect and make a patient awake. So it can be used as a sedative effect when blocked. And this is also clear when we use Panadol Night. It has antihistamine type 1 drug. Sorry. And in temperature regulation, and with inflammation, the temperature increased by many mediators. One of them is histamine. So blocking of histamine can regulate the temperature. عندنا الendocannabinoids. Endocannabinoids is from arachidonic acid derivatives اسمها anandamides, which is endogenous endocannabinoids activator. Endocannabinoids is a receptors of hashish, الحشيش المعروضة. It is not well known, لكن it has some effect which is known by us. It will be discussed inshallah. Endocannabinoids, we have a drug use the endocannabinoids receptors known as globulin and used for treatment of emesis as you discussed in GI. But because it is highly susceptible for addiction, it is not commonly used as a medical treatment. Like we discussed hashish and endocannabinoids in drug abuse and effect of the drug. We will discuss the details. The last one is purines. And purines, we have 2 receptors of purine, A and A1 and A2. And purines has adenosine receptors and give in sedative effect to anticonvulsive effect, and it is neuroprotector. We have methylxanthine, which give antagonist effect in the adenosine receptors, which is make arousal effect. That is why methylxanthine like caffeine and coffee وكده. So when we use the caffeine, it blocks these receptors, adenosine receptors, and adenosine receptor can cause sedation. When it is blocked, it will give a wakeful status. So it can give arousal or a wakeful status when use caffeine. That's all about the first straightforward lecture. Any question?
Thank you,
Thank
doctor.
you, doctor.
Thank you. Inshallah, we will revise the lecture rapidly before we start opioid in يعني next week أو كده إن شاء الله. Thank you very much.
You are welcome, doctor. شكرا.
شكرا جزيلا. السلام عليكم.
يعطيك العافية.